But with your guidance and encouragement, they soon know where they are and where they're supposed to be going.
Fascinating. What I'd like to do now is to move on to talk about the LBL itself and what actually happens. So the first question I have for you is, can you describe what happens in an LBL from a time the patient comes in the room to when they leave?
Okay, first of all, Alan, we call them clients, not patients, but that's quite all right. Some people think that they are patients, but they're really not. In any case, essentially what we do in the beginning is to take a biography, talk to them a little bit about what we do as therapists in a general way, and kind of get them to know who we are and what we're about, and to learn about them. And one of the interesting things I think about what we do is we explain that we would like the client to bring a, quote, cast of characters with them. Now, what do I mean by that? A cast of characters is a sheet of paper that the client works on at home before they come to your office, which explains who are the important people in their life and why. We're not just talking about parents and siblings. We want to know about relationships, the important ones. Now, if Aunt Mabel didn't have much impact on that person's life, we don't need to have Aunt Mabel. But we want to know those folks who had an impression, made an impression, good or bad. And it doesn't need to be very long, just a few words about each person. And what we do with that sheet of paper is that once the session actually begins and we begin to get into the spirit world, we're going to find out if those people are in their soul groups and so forth. So, and how the volunteer process of all this took place with this very difficult person in your life. Do you think it's an accident? No. You're here to learn something from them and they from you. Now, after this, most therapists, they each has their own technique. You know, we train people, but we don't have a foundation in stone that they have to follow. So once they leave our classrooms, you know, they work on their own procedures, if I could put it that way, as to just how they're going to take clients into the spirit world. Now, essentially after that, people do warm-up exercises in terms of deepening. We do a lot, and of course all hypnotherapists do this, but we have to do it very extensively. Body relaxation, getting into that place where you need to be in order to go as deep as we want you. One of the things that I stress very strongly is that as we progress through each hypnosis stage, once we place the client in hypnosis, the placing in hypnosis is very quick. It's the deepening that's my secret. And so as they go deeper, you need to check along the way. There's certain signs you need to look at to find out if they are with you. And if they're not, you need to back up and stop and work with deepening. Now, you might ask the question at this stage, are there clients who are incapable of going deep enough to do the work that they have to do? It happens. There are people who have difficulty with hypnosis. After some attempts at it, they may get around that point. There are other things that are I don't think we need to get into, which involve personal blocking for all sorts of reasons, which the therapist needs to understand how to work with. Where is this coming from psychologically? Are there things they're not supposed to know? Or is it basically a mechanical thing, where they have some sort of a fear about going any further because they're not sure whether they can handle the information that they're going to be getting? And see, before my books were written, there was not as much of a problem with it. Now they know what they're getting into. So they're more aware of this, but most clients are just fine. We take them first into their childhood, their current childhood. All the time we deepen, and I take them down generally to, age 12, age 7, age 3, and eventually I will want to know about their very earliest memories. Now, part of what we do here is to teach facilitators that they need to talk about childhood things that are not traumatic, because that's not why they come to us. If they need that kind of therapy, they need to get it at home with a psychologist or psychiatrist or clinical social worker who will work with them on a regular basis. They're coming to you for information about their immortal life, not therapy. I find that very hard for some of our students to understand. Not that that can't happen, and if they're academically qualified to do that, fine. But I think it's more important to understand that they're coming to you to unlock their spiritual state. They want information. So in any case, what I stress with the childhood memories are happy memories that involve geographic locations. The geography even of their own houses, how to go from one room to another, what do we see in certain rooms, because I'm preparing them for the spirit world. Because they're going to have to find their way around there in the beginning, and some get a little lost, but with your guidance and encouragement, they soon know where they are and where they're supposed to be going. So that's why we do a lot of that work in childhood. Now, from there I take...